Ever wondered about the difference between good and bad cholesterol? It's a question that's been on many minds, given cholesterol's reputation as a health villain. Yet, cholesterol isn't all bad. In fact, it's a vital substance to our bodies, playing a key role in the building of cells and production of hormones. But here's where things get interesting. Not all cholesterol is created equal. There's a duality to this substance, with two distinct types known as good and bad cholesterol. They're like two sides of the same coin, each with their own roles and impacts on our health. On one hand, we have HDL, or high-density lipoprotein, the so-called good cholesterol. On the other, there's LDL, or low-density lipoprotein, often dubbed the bad cholesterol. Understanding these two types, how they function, and their effects on our health is crucial. So let's dive deeper into what makes cholesterol good or bad. So, what exactly is this so-called bad cholesterol? Well, when we talk about bad cholesterol, we're actually referring to something called LDL, or low-density lipoprotein. Now, don't let the sciencey name scare you off. Simply put, LDL is a type of fat that travels through your bloodstream. But why is it considered bad? Imagine LDL as tiny, sticky particles. When there's too much of it in your blood, these particles can stick to the walls of your arteries, which are the blood vessels that carry blood from your heart to the rest of your body. Over time, this buildup, also known as plaque, can get thicker and harder, narrowing your arteries. This condition is known as atherosclerosis. So why does this matter? Well, if an artery becomes too narrow, it can't carry enough blood to your body's tissues and organs. If a clot forms and blocks a narrowed artery, a heart attack or stroke can occur. That's why high levels of LDL cholesterol are linked with an increased risk of heart disease and stroke, some of the leading causes of death worldwide. But here's an interesting fact. Your body actually needs some LDL. It plays a crucial role in building cell walls, producing certain hormones, and providing energy. The problem arises when there's too much LDL relative to its high-density counterpart, or HDL, which is considered the good cholesterol. And how do you know if you have high LDL levels? Most people don't show any symptoms, which is why regular cholesterol checks are important. These tests, often part of a routine physical, measure the levels of LDL and HDL in your blood. So the key takeaway here is that while LDL, or bad cholesterol, plays a necessary role in your body, it's all about balance. Too much LDL can lead to serious health problems, emphasizing the importance of maintaining a healthy lifestyle to keep your cholesterol levels in check. Now that we have a grasp on bad cholesterol, let's shift our focus to the good kind. Good cholesterol sounds like an oxymoron, doesn't it? But it's not. Let's dive into the world of high-density lipoprotein, more familiarly known as HDL, or good cholesterol. Now, why exactly is it termed good? Well, the primary reason is that HDL does a fantastic job of keeping our bodies healthy. Picture HDL as a diligent cleaner that goes around your bloodstream, mopping up excess low-density lipoprotein, or LDL, the bad cholesterol. HDL ferries LDL back to the liver, where it's broken down and eliminated from the body. This process helps to prevent the buildup of LDL, which can lead to the formation of plaque in the arteries. This plaque can narrow the arteries, a condition known as atherosclerosis, and increases the risk of heart disease and stroke. So, in essence, HDL is our internal superhero, tirelessly working to keep our cardiovascular system in check. But it's not enough to know that HDL is good for us. It's important to understand that maintaining high levels of HDL can be a game changer for our health. Studies have shown that people with high levels of HDL are typically at lower risk for heart disease. It's like having extra cleaners in our bloodstream, ensuring that LDL doesn't get the chance to stick around and cause problems. However, it's also crucial to note that the story of cholesterol isn't as simple as good versus bad. It's a delicate balance, and each type of cholesterol plays a unique role in our body. The key is to maintain a healthy ratio of HDL to LDL. This balance is a vital aspect of our overall health and well-being. So while it might seem counterintuitive, cholesterol isn't all bad. In fact, when it comes to HDL, it's downright beneficial. The more we understand about these complex molecules, the better equipped we are to keep our bodies healthy and thriving. Now you know the difference between good and bad cholesterol, but how can you manage these levels? Managing your cholesterol levels is crucial for your health, but how can you do it? Well, the good news is that there are several ways you can keep your cholesterol levels in check, and they all involve making some simple lifestyle changes. It's important to remember that taking care of your health is not just a one-time event, but a lifelong commitment. One of the most effective ways to manage your cholesterol levels is through a healthy diet. Foods that are high in fiber, such as whole grains, fruits, and vegetables, can help lower your levels of bad cholesterol. On the other hand, foods that are high in saturated and trans fats can raise your bad cholesterol levels. So, try to limit your intake of fatty meats, full-fat dairy products, and fried foods. Opt instead for lean proteins, low-fat dairy products, and foods cooked in healthy oils like olive oil. Regular exercise is another important factor in managing cholesterol levels. Whether it's a brisk walk, a bike ride, or a yoga session, any form of physical activity can help raise your good cholesterol levels while lowering the bad ones. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Frequent checkups are also essential in cholesterol management. Regular cholesterol screenings can help you and your healthcare provider keep track of your cholesterol levels and make necessary adjustments to your lifestyle or medication regimen. Speaking of medication, for some people, lifestyle changes alone may not be enough to lower high cholesterol levels. In such cases, cholesterol-lowering medications may be necessary. These medications work in different ways and have different side effects, so it's important to discuss your options with your healthcare provider. Lastly, remember that smoking and excessive alcohol consumption can raise your cholesterol levels. So if you smoke, quit. And if you drink alcohol, do so in moderation. Remember, understanding and managing your cholesterol is key to a healthy heart. Keep your heart happy by keeping your cholesterol in check.